What is Project Grace? QuickBase is extending organizations on the front line of COVID-19, such as local and state governments, educators, nonprofits, and healthcare providers, free access to COVID-19 response solutions through September 30th. How did Project Grace start? Project Grace began when the COVID-19 pandemic began to threaten the U.S. We wanted to help address the challenges you all were and are facing in response to the business disruption and community threats. We recognized life and work were going to become quite difficult for everyone, and we wanted to make some things a little easier. What does the program include? This initiative provides organizations access to our platform, time with a QuickBase employee to get you ramped up, and access to frequently used apps for the COVID response. Using QuickBase, these organizations can capture, track, and manage new workflows, unexpected activities, and new types of data brought on by COVID-19. How many people have been helped? At this juncture, we have 78 QuickBase volunteers supporting Project Grace and 20 accounts activated. This includes organizations that have qualified for Project Grace and are actively building to support their business processes. How can you be helping your own community? Since Project Grace is still in full swing, please share our efforts on social media at www.quickbase.com/crisis-response. If you'd like to participate, in addition to sharing the Project Grace efforts, if you have an app you've created, you can share that on our app exchange. Who has been helped? To date, we've helped create a medical response hotline for one of the largest U.S. cities, digitize processes connecting citizens with emergency resources, mandate new compliance requirements for a global manufacturer, track COVID-19 cases and assess business impact for an enterprise delivery service, and much more. You don't just have to hear it from me, though. We're going to share some quick insight from a healthcare provider, Geisinger Health Systems. They are one of the many who have greatly benefited from this program. The outbreak of COVID-19 is not going away anytime soon, and we want to do our part to help support our communities during this time. Thanks so much, and we really appreciate your support.
So we are talking with Becky and Emily from Geisinger today about how their jobs have changed over the last few months and how QuickBase has sort of helped them with that.
My name is Becky Miller, and I work as part of our human resources team here at Geisinger. The organization itself has been around for about 100 years. And our system now includes 9 hospital campuses, a medical college, a nursing school, and a health plan. We also have 2 research facilities, so we're fairly diverse in what we do. We have about 26,500 employees, including physicians, advanced practitioners, and support staff.
And I'm Emily Lafier, and I work for the Steele Institute for Health Innovation under the Geisinger umbrella. And this is a relatively new institute. It was founded in 2018. And my job is helping Karen Murphy, our Chief Innovation Officer, kind of run the overall efforts happening under the Innovation Institute.
So usually the first question I ask here, which is going to be really relevant for you all, I think, is how has your job changed?
My job changed literally overnight. As an HR leadership team, we had to come together to really figure out how we were going to meet the needs of our employees and the clinical needs of our organization.
In innovation, we're always taking on new projects and working in a rapid cycle. So our focus has become COVID. I will say that's how it's changed. We have a really focused effort around how can we support the departments across Geisinger to do what they need to do rapidly. And we have a number of departments under the Steele Institute that enable them to do that. Our digital transformation office provides digital tools and creates digital tools to help focus on COVID. So that's one of the ways we've really pivoted. But really, we're just helping manage the new normal. And this is an opportunity that we're taking to accelerate digital innovation.
And so can you tell us a little bit about like what you are using QuickBase to solve and how you're continuing to grow using QuickBase as a platform at Geisinger?
We had QuickBase before COVID happened. And the Steele Institute had just started to adopt QuickBase for our intake process before COVID hit. And we've become a huge fan and realize that there's a lot of opportunity to set up applications very quickly and intelligently with your automation features with your features for color coding and allowing for quick intake of data with Excel spreadsheets made it very simple and allowed us to create relationships between the different spreadsheets and for teams like HR to coordinate that effort and communicate between different teams.
I mentioned earlier that we were just trying to match up our needs with the employees that we had available. So we were able to utilize QuickBase to have managers submit their available staff and then have those managers who had needs submit their needs. QuickBase allowed us to match up skills. It did help us identify some gaps where we needed to train people. It also allowed us to track that training so we can quickly, on a day-by-day basis, know who we have where and when and move employees around.
I think it was a matter of a week that we really stood this up as far as the development aspect of it. Took it a few days to train the staff and then we were running.
Is there any way that you can feel like you can quantify sort of like the hours saved or the time saved or like what life would have been like without it?
I have to tell you, before we went live with QuickBase, we were managing this with an enormous spreadsheet. We have reassigned more than 2,000 employees. So if that gives you a sense of how much data was in that spreadsheet. When Emily introduced us to QuickBase and got us trained and we started meeting with folks from QuickBase, it was overnight change for us. And Emily's team helped us at 1:00 on a Thursday, and we were utilizing QuickBase on a Friday. So I realized the development perhaps took a week, but we were able to learn and begin using it the very next day.
From the development aspect, I will comment on the fact that if we didn't have QuickBase, we were planning to manage out of those spreadsheets. One of the teams under the Steele Institute is the Intelligent Automation Hub, and that's one of the groups that I run. And we were looking at how can we automate their process within the Excel spreadsheets. So we were going to build the functionality like QuickBase with the relationships of the spreadsheets, but still having them work in Excel and SharePoint. So I think that the time saved to not have to have that development team build the automation in that process was significant.
And I know, Emily, there's another sort of use case you guys are using QuickBase for that you've recently spun up. If you want to talk a little bit about that one too.
Yeah, so this was identified, I would say, about 2 weeks ago. The executive staff actually generously has offered up and taken a cut in their salary up to 30% and created an emergency fund, as well as offered up to any employee that would like to donate for those who are struggling across the Geisinger family to put in a portion to give to that. So we created a form and opened it to the public. So that's another great feature of QuickBase that allows a survey functionality and then just automatically has your data there. So there's no input by another employee from a PDF application or an Excel file. So very easy. We set the form up to where the public can go in, put in an application.
Yeah, I just actually want to add the employee impact. So we actually review it on a daily basis. QuickBase, obviously the data that we have available, our team meets every day to make decisions. And we have that money deposited in the employee's bank account within 48 hours of a decision.
Wow. What are like the early insights that you found about what life might look like when we go back?
Out of necessity, we're in one of the steepest learning curves of our professional careers. We're going to learn a host of new skills and processes that have been proven to work better during COVID. And I think, at least for a little while, without even mandates for social distancing, people will be just naturally doing these new things anyways. So it's become a part of our lives.
So I can speak in terms of numbers. I mean, prior to COVID, we had about 2,000 employees who were working remotely. We increased that by 4,000 almost overnight. So we have about 6,000 employees working remotely. And those are obviously our non-patient facing roles. And so going into the future, a group of us from HR are looking at that. People who support healthcare but do not touch patients may not need to occupy a physical building on our hospital campuses. We're concerned about the health and safety of our employees as well as our patients. And as we look at how much contact is needed, where people are needed to be, we are starting to already develop plans for the future in terms of how our employees will work.